This content is not intended to be a substitute for professional advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a health condition.
Hi guys, Dr. Sims here. I often have patients ask me all kinds of questions around getting sick. So today we're going to talk about sickness, a cold versus a flu, and pneumonia. What to do when you experience these things and how to protect yourself. We live in a time right now with a lot of information, which is great. The downside is anyone with a phone or a computer can put information out there, and it's just really hard to know what's true and what's not. I want to talk about this topic and empower you with information. I do apologize if this video is a little longer than usual, but there's a lot of important information to cover, so let's get started. There are viruses and bacteria all around you all the time. Most of the time, if our immune system is functioning properly, we don't ever even notice. We might touch them with our hands and they might get washed off, but well, what if we breathe them in? If it's through your nose, they could get caught in the hairs of the nose and they'll get filtered out. We might have to blow your nose or maybe even sneeze. If you breathe them in through your mouth, your lungs will filter them out and cause you to sneeze or maybe cough. That's why you should cover your mouth when you cough or sneeze, but not in your hands, hopefully in a tissue or maybe even your elbow. Viruses cannot infect you through your skin. The skin is actually one of the largest defenses in your entire body. You can touch just about anything you want and it won't matter. Until you touch an opening like a cut in your hand or a cut in your body somewhere, your eyes, nose, or mouth with your hands. That's why hand washing is talked about so much. Not really because the virus or bacteria can go through your skin, but so often we touch our face without even noticing. So let's say these viruses get past this first line of defense and actually into your body. The first things you might notice are a cough, runny nose, or maybe even a sore throat. All of these things are the body's way of trying to get rid of the harmful virus. You sneeze to get them out of your nose or lungs. They can get trapped in the mucus of your airways, so you cough to push them out. Then you'll either spit them out or you swallow them. When they get into your stomach, they're actually destroyed by the high acidity in there. A runny nose is another way the body traps the virus or bacteria in your mucus. Then you'll either blow your nose or swallow them, and they're gone. Have you ever had a runny nose for a while and you just can't breathe through your nose anymore? So you try to blow your nose and nothing actually comes out. Well, this happens because the sinuses are in the back of your nose, and they're what make the mucus, and they become swollen. And that will limit the amount of air that can actually pass through your nose. You could also notice a sore throat. For some people, that's the first sign that there's something going on. The throat gets sore because there are glands in the throat that help fight off infections, and they get inflamed when they're doing their job. Did you know that tonsils are actually one of those glands? Yep, that's right. Your tonsils are a very important part of your immune system. When they get inflamed, it's not because there's something wrong with them, it's because they're actually doing their job. Most of the time, these defensive measures will get the job done. If not, you might get a fever. And despite what you may have been taught, a fever is a great thing. A fever is your body's defense mechanism to fight off infections. Viruses and bacteria live in a very narrow temperature range. When you get a fever, it's the body's natural response to weaken or kill the invader. A fever can get as high as 102, 103, or even 104 in kids, and that's okay. I know fevers are not comfortable, but you should never take medication to reduce a fever. When you do that, you're allowing the infection to last longer. So, what's the difference between a cold and a flu? The flu is simply a more severe cold. Now, I know what you're thinking right now. You're thinking, no, the flu is a completely different virus. Well, the flu virus can also cause a cold. If you do the things you're supposed to, your immune system fights it off. Typically, if your body's defenses don't get rid of the invader within a few days, then the symptoms get more severe. When they get more severe, that's when most people go to the doctor. And they test you, and that's when you find out you have a flu virus in you. If they never get to that point, you don't get tested, and you don't even know you just fought off a flu virus. If you develop more severe symptoms from the virus, they could cause a high fever, body aches, fatigue, or feeling tired. Body aches come from waste that's being produced during the battle that's going on in your body. And fatigue is because your body is trying to put all of its energy into fighting the infection. If your body is still not successful in fighting off the invader, and depending on the length of time and severity of your symptoms, you could eventually develop pneumonia. Pneumonia literally means fluid in the lungs. Like I said earlier, a cough is how the body pushes mucus with the virus out of your lungs and airways. The longer your body is fighting the infection, the more mucus is created. And that can create a problem for people with difficulty breathing, smokers, young kids, and the elderly. They might not be able to get this fluid out of their lungs, and it creates an infection. At this point, your only option might be medical intervention. So, what can you do at the first sign that something's going on? The truth is, you probably already know what to do, but it takes a little bit of willpower. You need to do everything that you know is healthy and stop doing what you know is not healthy. Well, that sounds too easy, right? How about a couple of examples? First, you want to stop putting any sugar into your mouth, and this includes artificial sweeteners. That means avoiding candy, soda, and I know, even chocolate, just to name a few. Next, no alcohol and no smoking, and this includes vaping. All of these things weaken the immune system. There's more, but I'm sure you get the idea. After you've cut out all the things that are slowing down your immune system, you can start to do some things that will assist in the healing. First, I will say there is an exhaustive list of things that you can do to aid your immune system, so I'm not even going to try to name them all. Some of my favorites are vitamin C, vitamin D, and garlic. I have this old school chicken soup recipe from my mother that is amazing at boosting the immune system. Next, you'll want to drink plenty of fluids like room temperature water. Cold water can actually aggravate a sore throat. Hot tea can be especially soothing to a sore throat, and it helps to break up the mucus, making it easier for your body to get it out. Sleep is also very important during this time so the body can focus its energy on healing. Next, stress can make you sick. That's one of the reasons why people can get sick around holidays or important events. Do you know anyone that started getting symptoms close to their wedding? It's more common than you think, and it's really due to stress. Also, look at college students around finals. When you feel yourself getting symptoms, you want to eliminate as much stress as possible. That's why taking some time off of work or school might be a good idea. Also, happiness boosts the immune system. So while you're de-stressing, maybe watch a funny movie. Exercise has been shown to have the ability to boost the immune system as well. But when you're having symptoms, just don't overdo it. Next, go to your chiropractor and get adjusted. Getting a chiropractic adjustments helps your body to function better. When your body is fighting something, you want it to function as optimally as possible so it can do its job. So, what are things you can do to prevent yourself from getting sick? Do everything I mentioned earlier to assist your immune system when it's fighting something. All of those things support your immune system, and you don't have to wait to start having symptoms until you start doing them. Okay, let's talk about some common myths around sickness. First, cold temperature cannot make you sick. It's just not true. In order to explain it, I want to address another myth that gets perpetuated in the media, at home, and even by most healthcare professionals. Ready? There's no such thing as the flu season. I need this to settle in because some of you have been told this your entire lives, but it's just not true. Let me explain. The time of year that is flu season is typically during the fall and winter. Have you ever asked yourself why? Well, it's not that viruses hibernate during the summer. In fact, viruses are around us all year round. It's due to a couple of reasons. First, when it's cold outside, we tend to keep the doors and windows closed. We don't want that cold air out there in, but at the same time, the air in here can't get out. Fresh air is great for us, and during cold weather, we just don't get as much of it. Secondly, sunshine on our skin helps the body produce vitamin D. Vitamin D is very important to our immune system. When it's cold out, we typically want to keep our skin covered as much as possible. So we get less sun, and the body produces less vitamin D. To top it all off, we have a lot of holidays in the wintertime. What can come with holidays? Poor diets and stress. Combine this all together, and we have the perfect storm for weakening our immune system and increasing our chances for getting sick. So, the cold doesn't make us sick, and there's no season for sickness. But there is a time of year when we need to take extra steps to boost our immune system to help keep us protected. What if you're someone that gets a cold frequently? Well, you need to strengthen your immune system. but it doesn't happen overnight. And depending on how weak your immune system has become, it could take some time. Look, everyone needs to do what they feel is right. But I will say that every time you take a medication to fight off the symptoms of getting a cold, you're making it harder and harder on your immune system to do its job. And the weaker your immune system becomes. Think about it. We talked about how a runny nose or a cough is the immune system's way of getting the virus or bacteria out of your body. Let's say you take a decongestant to stop these symptoms. The body can't do its job, and this invader is allowed to survive in your body even longer. You need to remember, the symptoms are not the problem. The problem is there's a virus or bacteria in your body, and the symptoms are the body's way of adapting to that problem. Also, when you allow your immune system to do its job, the more exposed to viruses and bacteria you are, the stronger your immune system can become. This is how true immunity works. When you're exposed to something, if it's something your body has never seen before, you will get symptoms. If you allow your body to do its job and adapt, it will fight off the same invader faster in the future. I used a very important word. It is adapt. Your body is constantly adapting to its environment. Your symptoms are the body's adaptive response. True sickness only occurs when your body is unable to adapt. Again, everybody needs to do what they feel is right. And this is a little bit of a sensitive topic, but if I don't tell you the truth, I'm not doing my job. The stronger you make your immune system, the more easily you can adapt and fight off disease. When it gets strong enough, you will not need a flu shot because your body will know what to do. It will recognize the flu virus and fight it off, and the symptoms will never get severe. One final thought. If your symptoms are not extremely severe, you want to avoid antibiotics. Listen, antibiotics are an amazing life-saving medication, but there are definite negative side effects. Notice I said definite. These aren't possible side effects. These are side effects that are guaranteed. They weaken your immune system, and you are more likely to get sick again in the near future because of them. Somehow, antibiotics have become the go-to for just about everything, but they should only be used to save your life, and not just because you're uncomfortable. We need to learn to trust our bodies. Most of us have been taught that we were born into a hostile environment, and our bodies can't possibly survive without intervention. Except with very rare exceptions, this is just not true. Our bodies will absolutely take care of us as long as we take care of it. The only reason I'm making these videos is to empower you with information, so you can make better choices for you and your family. If you got any value out of this video, please hit the like button and share it. Drop a comment in the comments section if you have a question or if there's something you'd like to hear about in future videos. Thanks and have a great day.